Kia ora and mahalo elele. I'm Sione female. Welcome to the standingtallnz.org podcast. At standingtallnz.org, we support tāne Māori and their whānau through their healing journeys of mental health, addiction, and sexual violence recovery. We walk alongside those impacted by childhood sexual abuse, intergenerational trauma, substance use, and emotional distress, creating spaces for connection, restoration, and empowerment. Through wānanga, cultural and clinical support, supervision, and whakawhanaungatanga, we offer pathways that uplift the wairua, restore identity, and strengthen the collective. I'm with my host, Dr. Alexander Stevens II. How are we?
Kia ora and hello. Co-host, yeah?
Ugh.
Co-host. We
Or
share
in-
50-50. 50-50
Maybe-
responsibilities.
Maybe I'll say interviewee because I'll take over this episode.
Yeah.
But please
by all
introduce
means.
yourself for the
So, kia ora
if there's a
whānau.
new listener.
I'm Dr. Alexander Stevens II. I specialise in 8 different areas of health and well-being. And, yeah. I'm glad that you're a part of our small, humble little circle, having a listen to this podcast.
Right. This episode we're gonna be talking about the HUI TΑNE event that just passed, but I guess
in Kaitaia.
yeah.
So we're safely back in Auckland.
Well, yes.
So that was good. It was a bit stormy. It was a little bit
Oh
questionable.
yes. I think the weekend just before there was that storm that just passed. Yeah. But I guess we weren't too affected.
No. By the time we came down, we were fine. We were just looking
fine.
at
It was
cows swimming in paddocks and new lakes.
Yeah, I was surprised at how much rain
Yes,
affected those paddocks.
Cows helping horses.
Oh,
get
bloody
across
hell. Oh my
get across
gosh.
the other side. It was
No.
interesting watching that. So yeah. But what did you think anyway as part of the conference before you asked me? What were your general thoughts?
Oh, yeah, that was like a first. I don't think
Oh.
I've ever attended like a national.
Right.
I think they called it a national men's Māori health conference was, but
So you'd never done one before?
nah, not something like that. Like what was delivered there.
Right.
But it was good to know I wasn't the only Pacific person there.
Well,
Which was
what
just-
is the word? Pacific.
Yeah.
Tongan certainly,
Yeah,
but I didn't see. Yeah, no, actually, you're right.
Yeah.
There were other.
there was a Hawaiian dude. There was
but
actually
he
a
was only there
Samoan
for the
dude.
free food. I mean, really, well,
Oh,
he was there as part of the kai. I'm sure he brought something. I should
Maybe he took something away.
Yeah,
from the
yeah.
workshops.
Dessert. Actually, he was a cool guy. He was a cool guy.
Anywho, but for the new listeners, did you want to explain what?
I just want to say aloha to our Hawaiian
Brother.
brother that will be listening to this podcast.
Aloha, brother. The Hui Tāne event. Did you want to explain, like, I guess, what the whole context?
Well, my understanding is, look, 2 or 3 weeks ago, I got an email inviting me to take part in this. Up until then, I personally hadn't heard of it.
Mm.
And I understood it was raising awareness around wellness, and one of the things that they were looking at was around suicide prevention.
And then a whole list of other things as well.
Yeah, which included drugs. And I had a kōrero with the person that was kind of organising it in the background and said, look, if you're going to do this and this, then we need to talk about sexual violence trauma, because suicide, especially in rural areas, has association with sexual violence. And as we'll discuss, the evidence was there, and so I was glad that to be invited, and I don't know who passed on my name, but I should, I guess, extend appreciation
Oh, right, yeah.
to them, whoever they are.
What's his name? One hauora.
Oh, yes.
Well, I actually didn't know who he was.
What did you think of Uncle Hone? Oh, you didn't know? That's
I
right,
actually
you were
didn't-
sitting next to him.
Yeah.
You had no idea who he was, which I think is actually pretty cool. Because
I
then
knew-
you can be your genuine self.
I knew he was the opening spokesperson,
Right.
And he was like, and I'm like, oh, this old dude is doing very well.
That old dude has earned his stripes, Sione.
Oh,
It requires respect. Yes.
Yes.
But, and yet, I just want you can be your genuine self. There's no need to sometimes people act in, I guess in certain ways, when they're with, like really prominent leaders and or celebrities,
yes,
right?
yes,
So
yeah.
I guess from that perspective, it's good that you can actually be yourself.
Yeah, no, but he just sat next to and then just brief chats.
Good.
But I only knew I thought he was like the organizer.
Right. When I saw you two chatting, I just thought, Sione has no idea who he's talking to.
Nah,
Lol.
it's like, oh, Hone Harawira. Like people kept saying his name. Oh, this seems very important.
This only verifies what I thought. He has no idea who he's talking to. So, but good on you though. There were a few people that we met while up north that you didn't know who they were. So,
Nah.
good on you, Sione, for just, I guess, just being yourself. Yeah.
Oh, did you want to briefly talk about the 4 workshops you did?
Okay. So while I was invited up there, I thought we were only going to be doing 2 workshops. If I knew that we would be doing 4, I'd be questioning whether or not I was going to go, just because of how much energy was required. Grateful to be there, but heka, just the amount of energy required. So I was asked to go up.
The panel.
To be part of a panel talking about violence and suicide. Then I was asked if I would do a workshop, and I thought it was just going to be 2 hours. So
1 hour for one, 1 hour for another.
that's it. And as it turned out, I delivered four workshops, each one having between 25 and 30 plus men attend.
Yeah. Shout out to your personal administrator who.
Yes, yep. Shout out to that Tongan Doko in his famous pink shirt. And we had some pretty in-depth conversations.
Nah, so in-depth.
That we can't talk about specific individuals, but just the overall things I thought were very. It showed what I knew was that numbers are high, and that we needed to talk about sexual abuse recovery. Otherwise, we're not going to make a dent in the suicide prevention numbers.
Let's talk about the numbers then. So, what numbers are you aware of, I think, from MSD and those other services? And then what's the numbers you found from Standing Tall? And then what are...
Regarding what?
In terms of males affected by sexual violence.
Okay, so I know I've said this on a number of podcasts, both on this one as well as
I think,
on national ones. So on average, we tend to talk somewhere in between 1 and 4 females, and the average number for men tends to range between 1 and 8 to 1 and 6.
Now those two numbers, they were saying 1 and 8, 1 and 6 out of how many? Like what? Like 1,000 out of?
Yeah, well, that's the thing, is that those statistics are general,
Okay.
and it doesn't, and those are only the ones that have come forward, and also they come from, small studies.
Oh,
right.
Okay.
So actually, the true number we don't know.
Because I was gonna say, is this out of like the New Zealand population?
Yes. When I worked at Rape Prevention Education up in Auckland, we would say 1 in 8 men, 1 in 4 women. But again, that was based on small studies. The Male Support Services Trust would quote something like 1 in 6 men, 1 in 8 women. However, for our Māori population, if I put on my academic hat, I'm saying that it's 1 in 4 Māori males have been affected by sexual abuse, and it's 1 in 3 for Māori females. I'm actually edging more towards 1 in 3 for both.
Right.
And generally speaking, and then again, this is only based on small samples, it's about 1 in 5 for Pacific communities, irrespective of gender. So we're talking about a high number of people that have been affected by sexual abuse in our Indigenous communities.
Yeah.
I also want to say that it's not just Māori abusing Māori. Actually, what we know is that it tends to look at Caucasian males and females who abuse our populations. Quick example, we've had 5 teachers up in Northland, since we're talking about Kaitaia, who have been found to have sexually abused hundreds of children collectively. Each child belongs to a whānau member or family, and when you start to exponentiate those statistics out, then we're dealing with hundreds, if not thousands, of people that have been affected by sexual abuse, either being abused themselves or knowing someone.
Yeah, so that's that whole direct and then indirect impact.
That's what I say that sexual violence is a public health epidemic. It's an epidemic. And then if you look at the rate of suspected self-inflicted deaths for Māori for suicide, it sits at about 16.3% per 100,000 of the Māori population. This compares to a rate of, say, 9.0 for non-Māori, so that's through the Ministry of Health or the Te Whatu Ora website. And suicide is not equal across all populations, obviously, but when you have a look at the impact of those who have been affected by sexual abuse, a high number of those, feature in there as well. Exact numbers aren't known because, again, it's only those that come forward and are reported.
Yeah.
So there's a lot of work that needs to be done.
I think there's an interesting question in one of the workshops of them saying if there's a correlation between family violence and those affected by sexual violence, which is an interesting one.
Yes.
And then I think another interesting perspective is, can we say that there's a correlation between the impact of sexual violence and suicide cases?
Yes. Well, I think what's important is each of these people that have died are important, and each of them need to be, they deserve to be acknowledged. Because each of them have their own stories, and why people do this is it's like a fingerprint. There are different reasons for it, and what I argued is that sexual abuse is certainly, a reason why people either, why people make those decisions to commit suicide, especially if they don't get support. One of the things I was thinking about from the Mental Health Foundation is how they discuss how family and childhood experiences, including poverty, deprivation, physical, sexual abuse, alcohol abuse, and loss of significant family members can contribute towards
mental unwellness.
Yeah, mental unwellness and risk factors of suicide. And so, it's important to acknowledge that most of these risk factors are out of people's control. That's why suicide is so complex and needs to be understood. And what I said is, and part of that needs to look at the effects of childhood sexual trauma.
I think the reason why I was asking with the numbers was, you did get a significant amount of disclosures within the 3 days.
Yes.
And it's like, if we go back to those stats from the 1 in 8, 1 in 6, I mean, what are the odds that it would be like 1 in 8 in that room? Or most of them were like that 1 in 8? Yeah,
well, actually, it was that more 1 in 4.
Yeah. No, if we used the stats, all that 1 in 8, 1 in 6.
The Tauiwi stats,
Yeah, so it's like, ooh.
Well, so, on average, we had, say, 25, 30 men attend each workshop.
Yeah.
And to be fair, most of those men that attended the part 2 workshop that occurred on the 3rd day, right? So all up, so we had about 60 men come forward. And out of those 60 men, we had over 40 disclosures within a 3-day period. To put things into perspective, that would equate to 3 or 4 months of disclosures for me.
Wow.
And not all of them wanted help. Some of them just wanted to
share.
For the first time, we had a few people that admitted that they themselves were offenders
Yeah.
and needed help, which I hadn't experienced in my 22 years,
Right.
which I commended them coming forward, but was also concerned for safety.
There is, ethical dilemmas with that one.
In what way?
It's like, where do you even begin?
Yeah. I was talking to Nigel, who also volunteers with us at Standing Talk, and said, is it an ethical dilemma if one of those guys who had offended said that he's an offender and that he needs help? And I said to him, I didn't think of it as an ethical issue because he didn't go into details.
Yeah. Okay. Right.
You know, when we set that group up, it was, being really clear about this is what we know about the sector. They didn't go into details, and I felt like it wasn't an ethical issue because no one then stood up and said, this blah 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 offended me. In fact, if anything, those guys in there were very supportive for him. And I did forward on information for a couple of services that might be available to support him, because he didn't live up north, he lived in Auckland.
Oh, okay. Right.
So, but that was a new one
Right.
for me. For someone saying that in open public. So it was interesting because 99.99% of the guys that I work with haven't gone on to abuse others. Right? It's that 0.01% that might tell me.
And he was that one? He was
at 0.001%, but there were a few of them, right? Then we had other people who spoke about seeing sexual abuse happen and not sure what to do about it. We had other people say that they knew it happened in their family and community, but weren't sure how to deal with it. So whether it was at the workshops, being in the town centre, going for a brief walk, or at dinner, people wanted to let me know what was happening.
Yeah.
Which was interesting.
Yeah. We didn't really debrief.
We haven't even had a chance to debrief about it.
Kind of just
kind of soldiered on.
Yeah.
It was interesting because 40 disclosures, maybe just over 20 plus men wanted help, and a large percent live up north, and then there were those that lived in other parts of New Zealand, and internationally as well. And I just looked at them and I just thought, you poor buggers, because you can't, I knew that services are limited. They wanted specialised kaupapa Māori services, which become even more specific. And then, for I'd say between 10 and 12, we're going to have to take them on under us, because there aren't any other services that are available. And one of the challenges, I think, is because we're providing a mahi aroha, so we do this out of love. I just think that we need to get funding, Sione, because
good luck.
I know. I think about this all the time because we get told that funding isn't available, but I just think, how are we going to do this work? And do our other jobs as well. So you as a drug and alcohol counsellor for your HUI TΑNE, and obviously my main role at this point in time as senior Māori academic at AUT. I don't have an answer right now.
Well, I'll jump on to the next questions.
Yeah, please do. Let's see if we have answers for that one.
We'll hold off on that last question and maybe we'll come back to it.
Very good.
At a later date. But what part of your healing journey feels strongest right now?
Look, I think of this in two ways. One, the healing. What does my healing journey look like?
Yeah, what part of your
Listen,
healing journey?
I'm tired. I think the thing that I've learned is self-care is important. As you know, I celebrated my birthday and I've hit my early 40s again. And one of the things that I'm thinking about... okay, that wasn't that funny, Sione. But one of the things I'm thinking about is, hey, I've got to look at legacy. This is where you and Irie, my two mentees come in, because Do you remember that guy that spoke about the fact that this sexual abuse stuff is gonna be here after he's gone? This is the one that was in his 70s, and I said to
the
him,
gangster.
yeah, and I
G.
said to him,
The Cook
yes,
Island G.
and you can't, yeah, and I said to him, you can't expect me to magically wipe it all out in one generation. It's going to take multiple generations if we can succeed, right? And so when I think about my own wellness, I just think that this sector is not something that you want to do forever and a day. I've seen too many good people burn out. Way too many people burn out. And so, you know, I think about your own wellness, Sione. I think about Irie's, and I just think, how can I show you guys to look after yourselves? And what I've learnt up north is having limits. Because those 3 days were full on.
They were.
And it wasn't with love. It wasn't a paid thing. You know, I thought I was up there to help share some knowledge around, in my academic role, to share knowledge around sexual violence recovery. Had I known what was required of me, I would have probably. I know that there were lots of men that have got the help, and I don't dismiss that, right? I don't dismiss any of that, but it was pretty full on, and I felt like we didn't get the support needed.
I think I was kind of thinking on it, like we were just there for the workshops
and the panel, right?
But they kind of didn't fully explain the workshop in details. The panel, I don't even think they went through the panel like accordingly to what they had planned. But
I think people did the best that they could.
They did.
But and you know, I guess what I've taken. So I think you can learn lots of things, right? And so one of the things that I've learned is, in future, if we ever get asked to do this, I'm going to ask, like, what is your safety plan? Who have you got on board?
Do you have counsellors on board?
I mean, they said that they had a psychologist. I did ask, does a psychologist, because just because they're psychologists doesn't mean that they're trained in sexual violence, right? It's a specific skill set.
That was a conversation we had in the workshop.
Yeah. But I never got a response, so I didn't even know who the person was.
Right.
Which is why I stayed up until 2, 3 in the morning, just making a note so I could come back the next day and say, look, you live in this area, maybe you might want to try this service. And then some of the bros were like, what about working with you? And I'm like, I'm so sorry, I've got like a 6-month...
2-year waiting?
Yeah.
Or was it 12 months?
12? No, 6 months.
Oh, so ACC is different from...
Yeah, for my own stuff. So yes, I do ACC sensitive claims, but not as many, because that's a whole different kettle of fish. It's a whole different hurdle to overcome.
Alright. Okay.
So, yeah.
Alright.
But then part of the wellness is also looking at you, looking at me, and I was thinking, what if he's thinking, I smell burning out. You know, like, what did you think as people were... What were you thinking as people were coming up to me and, you know, as my mentee, what were you contemplating, Sione?
I was like, oh, well, because when they were disclosing, you didn't even complete the entire workshop that you had planned to do.
Yes.
Like, because you had to deal with the questions and then, like, the disclosures. Disclosures happened like left, right, and center. Sometimes it was like in private, sometimes it was openly.
Yes.
And then the whole complexities, like being directly impacted. There's the secondary impact, and then that one that disclosed about abuse as well.
Yeah.
So I was like, "You're the expert. I'm the volunteer. I take photos."
Yes, but at some point if this is the path that you want to walk on, right? And so jumping back for a second, this is why for our young Māori and Pacific drug and alcohol clinicians entering the field, this is why they don't last, you know, more than 24 months, because I don't think they're prepared for it.
Nah, I think it's good to kind of note this down, because I think in the next gen it's a new ball game.
I think so.
Because if our stats are wrong, remember that's what's the word? It's kind of what's pushing where resources go.
Yes.
But the thing is, if we start acknowledging it, it would be depending on who the government is, or good luck to them if they can handle this.
I don't think we're going to be in a
Pacific,
space
yeah.
anytime soon to fully support our men, both Māori or Pacific. And as I've said to you many times, sexual abuse is a human rights issue. Right? To me, it's not a gendered issue. It's a human rights issue. When we start saying that one gender is more abused than the other,
Right.
I just think that's not an Indigenous approach. An Indigenous approach supports the collective well-being.
Ooh. You can say that one again.
If I want to live, sure. Well, no, I am. It's a collective issue. It is a collective issue, and you need. I've said this millions of times. You need, within our Māori cosmology, Papa Tōnuku is Mother Earth, Rangi Nui is Sky Father. You need the masculine and the feminine to create a holistic environment of hauora, of healing. If you don't acknowledge one, but focus on the other, you're not going to create a wholeness approach, right? Which then looks at suicide, mental health, and addictions, which are the byproducts for many of our men affected by sexual abuse as children.
We're not saying one should deserve more than the other.
What,
We're just
with
saying
funding? Absolutely not. I'm not saying that at all. I'm saying
males just need to be acknowledged
and supported. See, we talk about women and children affected by sexual abuse, but when we talk about children, what are we saying?
It seems like we're just focusing
on the girls, right? But if we're talking about children, we should be talking about boys and girls.
Yeah, it's interesting that at what point does it just go from young boys to just men, and it's like,
and that's an easy one. That's before they turn 16. So, children doesn't have a set definition age-wise. But there's a point where our boys and men, we get kind of swept to the side. And I'm saying to you, if we're going to find a way forward, as a collective, we need to acknowledge both.
What also acknowledge that,
and I don't think that's an unreasonable request.
Yeah, neither.
Clearly, just based on the last 3 days.
Yeah.
One of the good things about working at AUT is I got a gentle reminder that I need to use some holiday leave.
Oh, that's very nice.
So I'm going to use that leave to go around parts of the country to help those men who reached out. So in a sense, I'm taking a holiday from my main job and working in another space. But I'm going to try my best to initiate some things like men's support groups, but also working on my own research as well. Focusing on those tāne narratives around sexual abuse and how do we support them. So, yes, the work was incredibly hard over the last week, but I do think there's been some positive things that have come forward as a result.
I guess.
Looking at your questions, what's next?
Where do you feel you need more support or connection?
I think we need funding in the sector for men. Right?
Agree.
I think that we needed to have, in that conference, we needed to have support structures in place to help. I think we should have had at least 5 to 6 therapists.
Yeah.
Other than myself. Although, can I also say, bless you, Sione, for wasn't doing the best that you could. I'm serious. I guess you're a provisional drug and alcohol clinician, and you were able to demonstrate competency and the ability to hold that that space and time. And as you know, there's very little, if any, kind of formal training around sexual violence recovery.
Yeah.
It's all hands-on. So you're actually becoming more specialised than your own colleagues in the sector.
Ah.
Yeah.
Very cool. What was I going to say? Oh, yes. I think we might have been the only ones registered with DAPANs at that event.
Yeah.
Yeah. So I was
hard to know because there were a few people that identified as drug and alcohol practitioners.
Yeah, so that's the thing.
But whether they were with DAPANs, I don't.
Yeah, so.
No, I don't know. I tried looking for them on the
Same,
DAPANs website. Oh, you did?
And I couldn't find them.
Yeah.
So I was like, oh, maybe it's a different name. maybe.
No, I don't think so. But I tried because I thought, oh, maybe we've got some allies.
Yeah.
But I couldn't find them.
Nah.
Yeah.
So
That was interesting that you did that too.
The next question: how has engaging with your culture and whānau impacted your recovery?
Well, if you mean for my own wellness, this is what I've learned. Up north has just as many issues around sexual violence as the work that I'm doing in Hamilton, in Gisborne, Wellington, and the South Island. Right? It's rampant. It's everywhere. And I guess the one thing I took away from my own recovery and wellness is that you can't hold, nor should you be expected to hold the space for everyone.
Nah.
I need to think at least 7 generations ahead, so that the next ones that you decide to mentor, and you better, as well as those.
Good luck to him.
Well, what does that look like, right? So you're currently looking at doing your masters. Your masters is focusing on sexual violence recovery, looking at Indigenous, and then what do you do if you decide to be an academic? How do you support the next generation? I'd like to think before I bow out, not anytime soon. I've got minutes left, to what that might look like for the next generation, the next so on and so forth. To me. I have to believe, brother, that there will be other practitioners that hopefully won't hold the same heaviness that I'm holding, and certainly you will be.
Or stronger shoulders on the next gen.
I think so. I mean, when you've got heart failure like I do, brother, you're very limited by the amount of physical lifting that you can do. But geez, I've got good calf muscles, so at least I can walk the distance.
Very nice.
Thank you, sir.
What challenges have you faced, and how have you navigated them? I think this is in regards to the week that just gone. Right?
Yeah, I think just the sheer number. So, like I said, I don't normally get, like I said, 40 disclosures in 3 days. That was amazing.
Yeah, and when you put into context, that's 3 months of work. Holy.
Well, it's 3 months of disclosures, which would equate to about a year's worth of work.
Oh, shucks.
That was phenomenal. And what was the question? Sorry, I lost my train of thought just with what you were saying.
The challenges and how you navigated them.
So this is where I guess like I said, I didn't go to bed like 2 or 3 in the morning. I just wanted to provide information based on where people were. Like living, for example, what their experiences were. Did they need specific help? What were their complex needs? So
providing care.
Yes.
Yeah, making sure the care is transferred.
One of the things that I'm contemplating is that in that space, I think I was expecting just to be academic me, but I ended up also being clinical as well. And I still have a clinical duty of like a clinical duty around care and well-being and safety.
Duty of care.
Duty of care, exactly. Haven't you learnt well from me, Sione? Well done.
Yes, I listen.
But yes, duty of care.
Well, that's a lot of topics we covered in this episode.
Yeah, maybe we should do a part 2, eh?
Yeah, we'll leave it to the one listener if they're
interested. I'm actually planning to spread this one as far as wide as possible, to be honest.
Do you think it's interesting?
Well, if we can get 10 listeners, I'd be impressed. But anyway.
Well, thank you for joining us on this journey today. Remember, healing is not a straight path. It's a process of ups and downs. Learning and growing, wherever you're at, know that you are not alone. Your story matters, your wairoa is strong, and your journey is valid. Keep standing tall, reach out when you need support, and walk forward with courage and connection. Until next time, kia kaha, kia maya, kia manawa nui.
Modi order. Modi order, my brother.